Another question on phenylketonuria, the main aim for first line therapy. So before we read the options, you have to understand what is the problem in PKU and how we are approaching to treat this condition. So what happens? The phenylalanine normally gets converted to tyrosine by the enzyme phenylalanine hydroxylase. Now this enzyme, if it is deficient, we get the PKU, also described as the classical PKU, nowadays known as PKU type 1. This particular reaction also requires coenzyme, just like the catecholamine synthesis. The tetrahydrobapterin is required, which gets converted to dihydrobapterin, which has to be recycled to give rise to the tetrahydrobapterin. Actually, two different enzymes are required, but here only one is shown. Now, sometimes there can be a problem with the tetrahydrobapterin also, in which case we call it the malignant PKU. The malignant PKU is subdivided into type 2, 3, 4 and 5. It is subdivided into the type 2, 3, 4 and 5, where there can be defect in the biosynthesis as well as the recycling. So when the PKU is there, the net result is whether it is type 1, 2, 3, 4 or 5, phenylalanine doesn't get converted into the tyrosine and it then gets metabolized to the alternate products. These alternate metabolites are neurotoxic. They are going to cause the neuronal damage. So let us see what is the alternate metabolism which is occurring for the phenylalanine. So as you can see, phenylalanine, if it accumulates, it can be undergoing the transamination. By transamination, phenylalanine gets converted to the phenyl pyruvate. Remember, this was the substance that we were testing in the ferric chloride test. This phenyl pyruvate can either be converted into the phenyl lactate or it can be converted to the phenyl acetate. Remember, we had said phenyl acetate can combine with glutamine to give us the phenyl acetyl glutamine. So, the substances which might be found in the urine, the phenyl pyruvate, the phenyl lactate and the phenyl acetate. Remember, the phenyl pyruvate will be the substrate which will react in the ferric chloride test. Phenyl acetate is the substance which is responsible for the mousy or musty odor of both the urine as well as the sweat. Okay, so mousy or musty odor is due to the presence of phenyl acetate in the urine, and the phenyl pyruvate will give the positive test with the ferric chloride. These three compounds are neurotoxic. They are causing the neuronal damage. So what we want to do? We don't want this reaction to occur. So only way where we can do this is by decreasing the phenylalanine concentration. That is why the management for the PKU is dietary restriction. Dietary restriction of the phenylalanine. So what we are doing, we are decreasing the substrate for the enzyme. For the alternate pathway, we are decreasing the substrate, that is the phenylalanine, by the first line of treatment, which is the dietary restriction of phenylalanine. In PKU, the main aim of first line therapy is decrease intake of phenylalanine. We are reducing the substrate for the enzyme of the alternate pathway. We are not replacing the deficient product. We are not changing the enzyme. We are not supplementing the limiting amino acids. Okay, we are reducing the substrate for the enzyme of the alternate pathway. Take a look at the enzymes, the products in the alternate pathway once again. So the phenyl pyruvate, the phenyl acetate and the phenyl lactate. Okay, you can remember it like this. The alanine on transamination gets converted to pyruvate. The pyruvate can either be converted to lactate or it can be converted to the acetyl coenzyme A. So what we are using here, the lactate part of the phenyl lactate, the acetyl part to the phenyl acetate, the alanine and the pyruvate part to the phenyl pyruvate. Okay. This is how you can remember the products, the phenyl lactate, phenyl acetate and the phenyl pyruvate.